here at Westside-Medical. Today I'm going to go over the sleeper stretch. What the stretch is, it's a stretch to increase mobility in your shoulder. So it's really good if you do any kind of like heavy bench pressing, overhead press, or even sit at a desk during the day. Those muscles back here can get really tight and cause some shoulder pain. So what the sleeper stretch is you lay on your side. It's pretty simple here. You want your arm at 90 degrees, and you're just going to push. You're going to push your arm down and just hold it like this. And as you do this, it stretches that posterior rotator cuff really nice to increase mobility in that shoulder. What you want to do is you want to just kind of push where you feel a stretch, but you don't want to overdo it. You want just a nice gentle pressure and hold it. So that's the sleeper stretch. In my clinic, we like to use a modification. We get a little mean with it. We use a lacrosse ball, and you put that behind your rotator cuff. What the lacrosse ball does, it's going to compress those tissues behind the shoulder, and then when you go through that range of motion, it's really going to break apart any adhesions. And honestly, it's going to hurt, but it's good. Trust me. So put that behind your shoulder. You're actually going to get your body weight up on it here, so you compress it. As you can see, where we have it there. You see that, buddy? Right behind that shoulder. You're gonna get your weight into it, and then you're gonna compress it, and then you're gonna pull it. You can do it two ways. You can compress with the hold. If you want to really work that mobility, you want to hold for about 2 minutes. That's to increase the range of motion of the overall shoulder. Or you can kind of compress it and then stretch, find another spot, get your weight up. See how I lift my weight up here? Get your weight up on it, compress it, and hold. So these ways, different ways you can work it here. Good. So that's the sleeper stretch. So pretty much the sleeper stretch. Lay on your side, arm at 90 degrees, and it's going to push down and hold. And that gentle hold there is going to stretch this whole posterior shoulder. So if you have any kind of shoulder pain, if you work on this mobility, that'll help with it. And the modification we use in the clinic, take a lacrosse ball, arm 90 degrees, and you're going to put it right in the back there. You get your weight up, compress it, and once it compresses tissues, then you go through that range of motion. So this here, it holds the tissues, and this kind of pulls it apart. So you can compress and hold it there, or you kind of compress it and just traction it out and do a couple ranges of motion. Good. So hopefully that helps you guys out. Visit us at westside-medical.com.